Have you heard of the Risk-Need Responsivity (R&R) model?
Yes, it's a guiding principle for offender assessment and rehabilitation.
The R&R model aims to reduce reoffending by addressing the key predictors of criminal behavior. These include the risk, need, and responsivity principle.
That's right. The risk principle focuses on the offender's risk of reoffending, and the need principle identifies criminogenic needs that, when addressed or changed, can reduce the risk of recidivism.
The responsivity principle emphasizes the importance of delivering the treatment in a manner that's compatible with the offender's learning style, motivation, abilities, and strengths. It recommends using cognitive behavioral strategies and tailoring interventions to the specific characteristics of each offender.
Exactly. The R&R model is effective in reducing recidivism, but it demands a nuanced approach. It's essential to assess each offender's risk level, criminogenic needs, and responsivity factors to determine the most appropriate treatment or intervention, rather than applying a one-size-fits-all strategy.
What are some of the recidivism reduction strategies?
Some correctional systems use universal treatment, which treats all offenders with a standardized program without considering individual risk levels, needs, or responsivity factors. However, this may not be cost-effective and could expose low-risk offenders to high-risk peers, potentially increasing their risk of reoffending.
What about targeted treatment based on R&R?
Rehabilitation programs are tailored based on the offender's risk level, individual needs, and responsivity factors. This approach is more efficient and effective, as it addresses the specific factors contributing to an individual's criminal behavior. However, it requires thorough assessment and multiple tailored programs, demanding more resources.
That's interesting. What about treating all offenders?
Not all offenders necessarily need to be placed into treatment programs. For low-risk offenders, placing them in intensive treatment programs might not only be unnecessary but could also be counterproductive. Research suggests that overtreating low-risk offenders can lead to negative outcomes.
Why is that?
Because low-risk offenders exposed to high-risk peers in treatment settings may adopt more criminal attitudes and behaviors, known as the peer contamination effect. Conversely, high-risk offenders benefit more from intensive treatments tailored to their risk levels and individual needs.
That makes sense. It's important to use a tailored approach to reduce recidivism.
Exactly. By addressing an offender's criminogenic needs using cognitive behavioral approaches, their risk of reoffending can be significantly reduced.